Next, we're going to move forward into the lower quarter screen. So remember, you always want to make sure that you have consent from your patients before you put any hands on them, and you want to stop immediately if they have any discomfort or if they just ask for you to simply stop. You can have the patient in either anatomical position, or you can have them with their arms across their chest. I think it's a little bit easier in this position just because their arms are kind of out of the way. So when I perform the lower quarter screen, I only use 2 fingers to trace the nerve root pathways. So remember, we're assessing L1 through S2. So I'm going to start back on the iliac crest. This is going to be L1. L2 is the greater trochanter. L3, so I'm going to flip my hand over, so I'm just touching on the back side of my fingers. L3, going across the thigh. L4, I'm going to start on the lateral aspect of the thigh and move medial, down the medial side of the calf. L5, I'm moving down the medial aspect of the medial malleolus and then down into the great toe. S1 is going to be the lateral side of the foot. Think about the base of the 5th metatarsal. And then S2 is going to be the triceps surae, or the gastroaxillaris and plantaris complex. So that is the dermatomes for the lower quarter screen. Next, I'm going to move into the myotomes. So for L1 and L2, I'm going to ask the patient to go into hip flexion. So I'm going to stabilize the shoulder, and I'm going to ask him to raise his knee up towards the sky. Good. And when, oh, no, you're going to hold it. Good. Hold here. Good. For L3, I want you to kick out towards me. Good. Hold here. Don't let me push down. Good. Relax. L4, I want his ankle in dorsiflexion, so I want you to pull it up here towards the sky, and don't let me push down. Good. L5, go ahead and relax. He's going to bring his great toe up towards the sky, and we're just going to take 1 finger, don't let me push down. Good. S1, he's going to go into ankle eversion, so he's going to bring his toes out towards me. Good. And don't let me push inward. Relax. S2, he's going to kick back towards the table. I'm just going to stabilize his knee and kick. Good, relax. There are only 2 reflexes that are associated with the lower quarter screen. That's going to be the patellar tendon, so that is for L2, L3, and L4. And then the Achilles tendon. So remember, we just want to make sure that the patient is completely relaxed. Sometimes it's a little bit easier if their eyes are closed, or if they're not anticipating the reflex. So you would simply just take your reflex hammer right in the middle of the patellar tendon. And then the Achilles tendon, you can have them slightly dorsiflexed and then just hit the back of the tendon in a seated position. Or I can have him prone, so I want you to lay on your belly. Good, and scoot down towards me so your heel is off the table. Perfect. And then I'm going to, again, just slightly dorsiflex him, and then I can test the tendon here using the reflex hammer, which we will talk about in class. And that would be for the S2 nerve pathways.